Hi, it is Dr. Simckes here at Fertility Partnership. Yep, I'm in the office. I hope everyone is staying safe. This is an extraordinary event, this pandemic, and hopefully we will get through it and together and with the least amount of loss of life. I hope everyone is sheltering and doing what we are being asked to do. At Fertility Partnership, we actually closed down and stopped doing embryo transfers almost a week before we got the directive from the American Society of Reproductive Medicine to do so. People are asking, when is IVF going to be back up and running? Don't know. We don't know. I'll talk about that in a moment. In the meantime, fertility to our patients who are with us now, Fertility Partnership is open. We may not be as responsive as you'd like to the telephones because every day one staff member comes in for several hours and answers phone calls, responds to requests for pharmacy, refills on prescriptions. So we're trying to keep all of our patients safe and give them what they need. So the question is, when are we going to get back to the business of making babies? So in the fertility world, with whom I contacts and colleagues, there are programs that are looking forward to getting started again in May. That right now to me seems a bit difficult. We here at Fertility Partnership had a very full, nearly completely full cycle in May, and a lot of people have decided to push it off for obvious reasons, but we still have some people who would love to move forward in May. And so I'm listening to my peers. The way it could work is if we really do peak with the pandemic in the next week or two and we start to get better, and if we have better treatments and better understanding of how the disease works. But also the most important thing would be that we can test people. So we are in contact with our company that we do our genetic testing called iGenomics, and they may be able to provide for us something called the rapid test. Those of you who listen to the news know about this. The rapid testing can give you an answer in 2 to 5 minutes. I don't want to get too technical, but it can test IgG, IgM. So if we were to move forward, we would have to set up a table, a desk out in the hallway to do the rapid testing. And then we would do the more formal testing that takes, as of now, 2 to 5 days to come back, but it's billable to your insurance, and then move forward. But why push it? Well, there are some people who are very worried. They're worried because their egg reserve is low. They're worried because of other factors in their life and would really like to move forward. I hear this from my colleagues, that they're under pressure from patients to move forward. I'm not sure, but I'm keeping an open mind. So I'm reaching out to my patients and to any patient who is out there that Fertility Partnership is considering having a May cycle. You would need to address us directly. You can do that by going to our Facebook page and messaging us directly. I personally check, and Sarah checks our messages all the time, and you can reach out and we can set up meetings. I came in today and we've had several virtual meetings with either Skype or FaceTime or telephone, and we can begin the process of getting things prepared, and we can even get meds prepared and ordered. So it's not impossible to move forward, but the only way I would do it is if it's safe. Patients who I would consider moving forward with are people with low egg reserves, for example. And the thought of waiting 3 or 4 months, if you're 39, 40 or older, could be very, very worrisome. I worry about the stress of getting people pregnant during the crisis. The effect of the virus on pregnant women is yet unknown. It's not believed to transfer from the mother to the baby, but we think the miscarriage rate might be higher, but we're not sure why. Might best be from the just sheer fear of being pregnant in the midst of all this. But God willing, we get through it all together, and if there's no May cycle, then I'm hoping for a June cycle, and then we'll have June, July, August, and we will double it up and work hard to provide care for everyone. For those of you who have never been to Fertility Partnership, you should read our reviews. Read our reviews on Facebook. Go into Facebook rooms and chat rooms, and you'll see that we have been the program that has tried to find the highest success rates at the lowest possible cost. Why? I always tell people, call my mother. She'll tell you. It's just what we've decided to do, and we've done a good job. Those of you who want to verify what I'm saying, just go to the CDC website and you will see that our success rates are higher than programs that charge 2 to 3 times what we charge. We love what we do here, and we're sad that we're not able to move forward right now. But there's a lot of things that we can do through virtual medicine. So contact us, either through our Facebook page or our website. We are checking our emails every day. People who have questions for our office manager who handles finances, that's Amy. If you call the office, you can get her website, and her email, and she will call you back. We are going to keep it together and get through this together with you so that you can build your families, so that you can be part of the baby boom that everyone's talking about. We love you there. We got eggs. You have the eggs. We're going to go get them, and we will make babies together. And I look forward to seeing you all when this is over. God bless.